Thank you, Mr. Speaker. Allow me to quote a memo from the Health Minister regarding how AHS botched the closure of Little Bow Continuing Care Centre. Quote, there needed to be a clear, concise communication plan with care residents, their families, and the community at large. It goes on. AHS has learned considerably from this experience, and it is utilizing these lessons to inform future decision-making, unquote. Why then, Minister, were the residents of the long-term care wing of Strathmore Hospital, their families, members, and staff completely blindsided by yesterday's announcement to close the beds? Didn't you learn anything from Carmen Gay?
Mr. Speaker, first of all, let's be clear. The long-term care services that are currently provided in the hospital, Mr. Speaker, in Strathmore, are being moved to a brand new facility in the community that will provide a much better, much more respectable and amenable environment for those residents. In addition, Mr. Speaker, 82 additional spaces are being added in that new facility. I think, Mr. Speaker, the residents of Strathmore feel very well served by the new facility, by the services they're going to be able to offer, and I know they were consulted, Mr. Speaker.
Honourable member.
Obviously, we haven't talked to the staff or the seniors, but given that the 23 seniors who live in Strathmore facility, many of them with high needs, will be transitioned to beds lower care levels, and given the Health Minister's own memo stating they had learned from the mistakes at Carmen Gay, what is the Minister's explanation for blotching yet another long-term care centre closure and throwing the lives of vulnerable seniors, families, and staff into total chaos?
Well, Mr. Speaker, if this honourable member wants to stand in front of this House and make an argument that residents receiving long-term care in his constituency should remain in the hospital instead of moving into a brand new facility, then I think he's got some explaining to do.
The costs are up, and they're not going to get the same care. Given that the residents, their families, and staff found out about the closure by mistake, given that they were supposed to be kept in the dark until May 1st, and given the Minister's memo states AHS and his ministry is, quote, making progress in the community engagement process. Can you explain to this legislature and to the community of Strathmore how blindsiding vulnerable seniors with yet another long-term care centre closure is making progress and learning from your mistakes?